How can evidence be used more effectively for mental health policy in Assam? This video will share our summary of the initial key findings of our research conducted by the University of Leeds. Our research aims to understand the role of evidence in setting the agenda for mental health policy in Assam. This will help us to understand how best to communicate evidence on mental health to policymakers. This video briefly outlines our 6 key findings and provides background for a short survey in which we invite feedback on our study. We use 2 sources of data. First, we conducted a literature and document review. Second, we interviewed a range of mental health stakeholders in Assam and across India. Thank you again to everyone who took part. Here are our 6 key findings. 1. We found that different types of evidence are useful for policy making. Formal evidence based on scientific studies and using statistics is valued. However, informal evidence based on personal experience, such as expert opinion, is also influential. Interestingly, personal and community narratives, especially in combination with statistical evidence, may be particularly powerful. 2. We found that more evidence is needed, but also that the evidence already available, such as the National Mental Health Survey, could be easier to find and use. 3. We found that evidence needs to be communicated clearly and in a relatable and engaging way. For example, storytelling using creative mediums is an approach that could be explored further. It is interesting also that the person communicating the mental health evidence has a big influence on the extent to which that evidence is heard and acted upon. 4. We found that evidence needs to be shared more widely amongst all stakeholders, including policymakers, practitioners, and communities. Wider sharing of evidence will also help all these stakeholders shape mental health policy making. 5. We found that community-targeted approaches are important to raise the profile of mental health policy in Assam. Community approaches are also important to make sure that the mental health policy agenda is informed by people with mental health challenges and those who care for them. Finally, 6. We found that mental health stakeholders need to keep talking to each other and find many opportunities to discuss and share evidence. It is really important that communication is a two-way process to allow genuine co-creation of the mental health policy agenda from the best evidence available. We have shared our key findings and now invite you to complete a short survey to help us make our study as useful as possible. The link is provided in the email sent to you. Thank you for watching.